It's another day with the physicians where your health is our business. The growth spot will end, so they are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when the pressure is high that you have glaucoma.
Sugar. And I don't know about any other one, but what is low?
You're welcome back to the training of the program. Infertility is defined as not being able to get pregnant or conceive after 1 year or longer of unprotected intercourse. Infertility, as against popular opinion, is not always a woman's problem. Both men and women can contribute to it. Our expert on today's episode on your regular and favorite health TV talk show, The Physicians, will take us through about infertility, its causes and management. If you're just joining us, this is your favorite health TV tech show, The Physicians, where of course your health is our business. Today we're going to take you back to the basics, something very important, something quite necessary in every part of our own living, and it's about infertility, the causes and its management. I remain Dr. Emila Yusuf Kadri, and of course with my lovely co-host, I'm Dr. Martina Agbemi. Welcome to The Physicians, where your health is our business. We're discussing a topic that's quite sensitive. Very, very sensitive, you can say that. Quite sensitive because we know it, but a lot of times we play the ostrich. People are in denial. A lot. And as against the popular opinion, we are seeing it scientifically, medically, is not a woman's own problem. You quite see a lot of women, because women naturally are programmed to speak up, seek for help on time. They're the ones that will come to the clinic, see the experts, and say, I've gotten married. I know when it's time for marriage, everybody will come out, dance and everything. 6 months down the line, people are like, in fact, from that marriage, there's some kind of music they'll be playing, like telling you that, look, we are after this, so we are coming to carry baby, we are coming for omugo. So there's always that expectation. And that put pressure on the couple too. I think actually the couples put pressure on themselves. But again, we still have a good percentage of people with infertility, not just the primary one. We also have what we call the secondary infertility, where you have people with baby after 6-7 years are trying to get the second one, and problems. One thing that is now actually coming to the fore is that men are beginning to accept that I'm also saying that in the past everyone would always think the woman has a problem, but now the men are. So for today we're talking about infertility. On that day we talk about the use of contraceptives. It's still because they go hand in hand, and infertility is quite sensitive, and we understand how sensitive this topic is, and that's the reason why we brought in an expert, not just an ordinary expert. We're going to talk to a prof. So we'll be right back after this time out. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where of course your health is our business. And today we are diving into a very important topic that covers a lot when it comes about human living, and this is all about infertility, the causes and its management. And with us today in the studio is no other person, the renowned Professor Anthony Akinloye Bamigboye. Is a consultant obstetric and gynecologist and the MD CEO of LOUISMED Hospital, Lagos, Nigeria. You're welcome, sir.
Thank you so much.
Welcome, Prof.
Thank you. Nice to have you here.
Sir, this topic is quite sensitive.
Yes.
And then you are an expert in this field. So we that are not expert, we know how we feel when people ask us questions regarding infertility. So we can only imagine what you go through on a day-to-day basis with clients and patients. So we want to just have for our viewers an overview of infertility and what leads to it.
Thank you so much, Miss Editor. Infertility in Africa south of Sahara is extremely common. In couples, we have nothing between 30% to 70% of infertility in Africa.
Whoa!
South of the Sahara.
What is infertility? So
high.
You understand what infertility is?
Yes, infertility thing is inability to conceive. By couples haven't had regular sexual intercourse for at least 12 good months. And the editor made mention of age factor just now. I heard that saying that. And if you look at the age, when you are not able to conceive for 12 months, you get panicking. But if you are 35 years old or more, 6 months is ideal to go.
So be worried about it.
Yes. So infertility is that common. And then we have it occurring as a factor of the male and as a factor of the female. In factors pertaining to male, in the past it used to be lesser or lower than females. But things have now changed to the extent that in males and females the factors are almost the same. We used to have things like a factor of 30% before, 30% male, 30% female, 30% unknown. But it has changed, from 1980s to what we are now, whereby we have infertility occurring in 50% of female and almost the same rate as in male. Yeah. So we have the unknown factors, 5 to 10%. Unknown factor is still precarious in that we do not know the causes for everything. So that may be unknown factor. Otherwise, the rate is the same in male and female. In male, the causes of infertility are legion, many, but you are just looking at the pathways. What are the pathways of sexual intercourse in a male? The thing is formed in the testes. The spermatozoa is transported from the testes into the vaginal canal through the channel across the penis. So if there's an obstruction in the penis, either congenital or acquired, you can have infertility, male factor. If there is a problem with the production of the sperm, like a genesis of the sperm could happen. If there's infection in the testes, like mumps, viral conditions, if there's a bacterial infection as well, like gonorrhea, chlamydia also is there, those things can affect the quality of sperm that we're producing. So if you take that male factor away, even ordinarily having intercourse, and you have conditions whereby you produce sperm too early, called ejaculation prematurely, then you can ejaculate in the wrong place, before you actually enter into the pathway of the female. So those are things that can cause it in male. In female is a bit more straightforward, whereby we have things that can affect the cervix, that can affect the ovaries, that can affect the fallopian tubes, and we also have factors that can affect the myometrium, the uterus, things like fibroid, things like polyps, and so on and so forth. We also have things like endometriosis, whereby we have abnormally situated inside of the womb, anywhere outside the womb. It can be on the ovary, it can be on the tube, it can be anywhere, cervix. Then those things will produce toxins that are inimical to the growth of the egg, and at the same time can block the fallopian tube, can block any passage along that tract. That is the overview of infertility that I got. There are many things to talk about, but that is a brief overview.
Okay, so what are the different types of infertility that we have?
Yeah, thank you very much.
Both in males and in females.
For females, we have, in fact, for both of them, we have primary and secondary infertility. Primary infertility is as a result of somebody who has never been pregnant at all. Never. Whereas secondary infertility is somebody who has been pregnant before. And if you are pregnant before, it's the history of being pregnant that we know of. We ask you, do you have any child alive? Yes, that can classify you as secondary because you've been pregnant before. If you have been pregnant and you had an abortion or miscarriage, you are classified as secondary. When people are secondary, we tend to be a bit more happy. We tend to say, yeah, we can do something here quite easily. But even at that extent, you cannot be sure after all. Yeah. So, but primary infertility, that person has never been pregnant, never. And that's, you have to start thinking of genetic problem, allergies, blockages of so and so, both in male and female, that can occur.
So we do hear some of the myths, and we want to hear from you, being an expert. Are these truly myths or they are facts? One common one among the females is that if you have a lot of abortion before you get married or before you finally settle down, you are likely to be infertile. While for the men, if you wear tight trousers or you put phones in your pants, your trousers, you are likely to be infertile. Are these myths or they are facts?
Most of what you have said are actually science based. Of course they are myths. I will discuss the myths, but we will emphasize on the science. Okay. You said that if men wear tight pants and so on, they may be infertile. Yes, the answer is true. It's true because you see, God or nature, if you believe in nature better than God or whatever it is, they created human testes outside of the body. Yeah. That's why the scrotum is hanging out. And when the scrotum hangs out, and then you expect the coolness of the air to cool it off and make the temperature low, then fertility will be in. But then if you have somewhere where the temperature is high, as people driving a long distance, if you are head up in the traffic, yes, and then you are on the road for hours, your scrotum or your perineum is hot. That is very serious. And people always in traffic. Always, that's the problem. Always, and if you do that, you find out that the scrotum or the groin is hot, and the sperm will be hot, and spermatozoa that cannot survive high temperature, and then you're going to have abnormal sperm. People driving long distances, trucks. So long distance drivers are people taking petrol from east to the west to west to the north and so on. They are bound to have problems with fertility because of the long distance and the heat. Because of the heat for a long time. Yes, and some people also they enjoy putting their phone in their pockets. Radiations. So that thing is true. It is true. Studies have been done. I've read it myself in the past, whereby the radiations from the phones are inimical to the growth of spermatozoa. Let's hold on to that because you are giving us things that we should actually listen, pay attention to, and stop looking at. Village people are not after you. There are certain things that you are already doing that are not helping you. Phones in your pocket, sitting for long hours in traffic. These are some of the things that we're talking about, male infertility. Let's go out there and speak to people on the street regarding infertility with Keeping Up with the Physicians. We'll be right back after this time out.
infertility is when a woman cannot give birth or cannot produce.
Yeah, to me, what I understand by infertility is when a man and a woman could not be able to produce.
Infertility. I think what I understand by the word infertility is a disease of the male and female reproductive organ.
Number one is when there is a health issue, maybe they have infection, it can cause it. Another thing that I think that can cause it is when the man or the woman has a very low libido.
Disease, like I rightly said, we have a lot of STDs, sexual transmitted disease, that can bring about infertility. And I know this disease, when they stay longer in your body, they tend to damage organs that that involves you being able to to reproduce.
From the female, it could be through fibroid, or maybe she has any underlying ailment or so. The man could be low sperm count.
Yes, it's good both of them go. The best people to see the doctor is both of them.
Both of them should seek medical advice from a doctor.
I'm sure you got all the answers you've been requesting for on the street from the people you've heard with what they think about infertility, and we are also being schooled on what can lead to infertility that people aren't looking into. Prof has been giving us all the necessary hints, especially for young men out there who are still desirous of having families. He has talked about phones in your pocket. He has talked about sitting in traffic for hours. He has also talked about long distance travel. And Prof was about to tell us about fumigation. Prof, what has that got to do with infertility?
Yes, in 1980s, a professor in Benin did a study on aflatoxin, which is a type of fungus killer agent that was inimical to sperms, and that study was not carried around quite well. And but when he went to Europe, that was taken up, and he became a professor quite a short time. But on coming back in 90s, more emphasis were placed on such things as fumigation, whereby the chemical agents in those insecticides, the herbicides, were studied, and they found out that people who spray with insecticide, people who go on herbicides in the farms, they are more infertile than ordinary people on the street.
That's occupational hazard?
Yes. So, and we've been telling people ever since, because research is something for people to do research, but it's another thing for people to know about it.
Yes.
The communication, to broadcast it out so that everybody can hear, can see what is going on is paramount. That was done on fumigation, and in the same vein was the issue of hot bath. People having showers, hot showers or saunas and so on. So we found out that young people do not know all of this, and what we are bringing out in this interview is basically what are the practical things that we see. What are the things that, not the theoretical things that we all know, but the practical things that everyone does or everyone do in their daily
so hot baths. But people pay to go for saunas and spa.
Absolutely, they do pay for that, and they should realize that it's not the best.
So for females, what are the risk factors? What are the things that increases infertility in a female?
The risk factors for female infertility are also legion. There are many. You won't believe it. One very common one is obesity. Obesity, which means a BMI of like
more than 26,
more than 26, 30, more than 30 is so bad. You won't believe it. The incidence of obesity causing infertility is more than 10%. So what I normally do in my practice is to tell every woman who comes there what is her weight. They will tell me, so I calculate the BMI. If the BMI is in the range of 30s, immediately I will say, before I see you next time, I want you to drop your weight by this.
What is the link, before you continue, what's the link between that obesity and infertility?
Obesity will not make you to ovulate. It will block your ovulation mechanisms, so that you will not be able to ovulate freely. Then there will be infertility. And it's a very common thing. So after infertility, after obesity risk, then we have smoking as a factor. These days women do smoke.
Yeah, they smoke all sorts.
Yeah, they smoke all sorts of things. You are right. And when you smoke, you decreasing your female end ability to pick up the eggs. That comes every month, you see. So that is affected one. Then the transportation of the egg from the female end of the tube through the tube down to the womb is decreased, because the cilia, the cells, which
are not as mobile as it is.
You are very correct. Yeah.
So what is the management? How do people manage? Because you are the people that they come to, you know, the IVF center, the fertility, and everybody is running up and down, even if they don't know the agbo, because we don't want to even dive into that. Being an expert, how is infertility being managed?
Infertility is a scientific issue that I tell my clients from A to Z. If you are good enough to listen, you will understand it. If you don't understand, you ask me again, because we are going to manage it together, both the clients and the doctor. Yeah, the moment the client doesn't know what it's all about, then you are not going to get anywhere. The husband is so important. They must be there. I insist in Lagos here that the husband must be on suit for me to manage this case. And management is geared towards finding out the causes of the issue. The male causes, the one with thyroid problems here, I will sort them out. The ones we do blood tests to know whether there's a thyroid issue or not. We do other tests like sugar tests. Diabetes is a factor. You might want to try and do sugar tests to ensure that the sugar level is correct. You want to check if there's you want to palpate, to touch the testes. Is it smaller than before? Is it some we have untended testes. That one is the testes in the tummy. Okay, so if it's there, it can cause cancer. You are able to remove it, harvest the sperm if it's still viable, blah blah blah, and do that. Then you must do that. If it's due to mumps, you can do some assay, you can do some treatment. Chlamydia, gonorrhea, you treat broadly, and you see whether this sperm test will improve. So every infertility cases, the couples must come with the man. So I'm going to examine the man first. So it's after I've done that I'll then proceed to see the woman. Quite a lot of
this has been quite enlightening, especially bringing the fact that infertility can be hereditary, and that's why history taking is very important, and letting us know that there are certain things that we need to look out for. Thank you very much, Prof. Thank you. And then of course we want to take this further, because I'm sure there's questions that will come out from this discussion from our viewers, and then we hope that when next we call you, you'll be able to give us that few minutes to discuss this topic. Infertility is common in Africa, about 70%. So it is not something we have to sweep under the carpet, but have to discuss it even before you marry. I remain Dr. Memuna Yusuf Kadri. Thank you very much.
My name is Dr. Martina Agbire. Remember to follow us on all our social media handles, Facebook, Instagram, and of course the YouTube. If you want to be part of this program, just click away, just send us a mail and you'll be invited here. Thank you and stay blessed.
Everybody, my name is Yewande Adekoya. I'm a pharmacist, a wellness and a lifestyle coach, and I'm here on The Physicians talking about self-care. Self-care is taking yourself seriously, putting premium on yourself, and living an intentional life. Thank you for watching The Physicians.
Clinically yes, technically no. So let me explain. Malaria is caused by a parasite. carried by the mosquito, the female Anopheles mosquito. So hence that your story. Mosquito bit me last night, I have malaria today. Not quite true, but the link is there. You have to be bitten by a mosquito that is carrying the